Welcome to MediByte. As a healthcare professional, I am absolutely thrilled to guide you through today's explainer. We're going to take a very structured but totally reassuring look at early pregnancy symptoms. Specifically, we're focusing on nausea, vomiting, and pelvic pain, so you can understand exactly what your body is doing during this incredibly wild time.
Look, let's just dive right in by validating a reality that many of you know way too well. As the old saying goes, morning sickness is often just all-day sickness in disguise. Seriously, it is completely normal to feel totally exhausted when your body is changing this rapidly. But I want to reassure you right out of the gate, you are not alone here, and there is a medical explanation for almost everything you're feeling. Trust me, understanding that medical why can make this whole journey so much smoother.
Okay, to make all this complex medical info easy to digest, here's our roadmap. 1. The morning sickness myth. 2. Causes of early pregnancy nausea. 3. Normal versus abnormal pelvic pain. 4. Red flags and warning signs. 5. Treatments for your symptoms. And 6. Your MediByte health takeaway.
Let's hit Section 1, the morning sickness myth.
There really is an end in sight, I promise. For most women, nausea typically kicks in right around week 5 of pregnancy, hits its absolute peak at about week 9, and then, thankfully, it usually disappears completely by weeks 16 to 18, just as you're settling into the second trimester.
Now, we do need to draw a clear line between standard, run-of-the-mill discomfort and a much more severe condition called hyperemesis gravidarum. If you're throwing up occasionally, but you're still able to gain weight and keep fluids down, that's normal morning sickness. Hyperemesis gravidarum, on the other hand, is severe, persistent vomiting where you actually lose weight and become dangerously dehydrated, and that absolutely requires medical intervention. If you're dealing with hyperemesis gravidarum, your body might actually enter a state called ketosis. Think of it like your system switching over to emergency backup power. Because you literally can't keep enough food down for energy, your body starts breaking down your fat reserves. That process creates waste products called ketones, which are what lead to that extreme fatigue, bad breath, and dizziness.
Moving right along to Section 2, causes of early pregnancy nausea.
So why do you feel so awful? Well, while the pregnancy itself is usually the culprit, your doctors are always going to double-check to make sure something totally unrelated isn't the true cause. They have to rule out everyday things like gastroenteritis, a stomach bug, or even appendicitis, because obviously those require completely different treatments than pregnancy-related heartburn.
But if it is the pregnancy, it's essentially a perfect storm in your body. Early on, you get this massive, rapid surge in two hormones, HCG and estrogen. Combine that with progesterone, which actively puts the brakes on your digestive system, slowing everything down. Throw in the sometimes harsh iron found in a lot of prenatal vitamins, and honestly, it makes total sense why you'd be feeling so incredibly sick.
All right, Section 3, normal versus abnormal pelvic pain.
Let's shift our focus downward for a minute. I want you to picture your pelvis not as a rigid box, but as a dynamic, constantly changing structure. Pelvic pain, which hits right in the lowest part of your abdomen, is incredibly common. Most of the time, that pain is just your ligaments acting like giant stretching rubber bands. As your body shifts to literally make room for a growing human, feeling a sharp or crampy sensation that comes and goes is completely normal.
But it is absolutely vital that we separate those normal growing pains from serious obstetric complications like a miscarriage or from unrelated issues. For example, urinary tract infections happen a lot more frequently during pregnancy. They can cause a ton of pelvic discomfort, and they definitely need to be treated fast so the infection doesn't spread to your kidneys.
We also have to talk about ectopic pregnancies here, because this is the most serious, life-threatening cause of early pelvic pain. If a fertilized egg implants outside the uterus, usually in a fallopian tube, it just cannot develop normally. As it grows, it can actually cause the tube to burst, leading to severe, sharp pain and heavy internal bleeding that requires immediate treatment. Which brings us right into Section 4, red flags and warning signs.
Okay, so when do you actually need to pick up the phone and call your doctor about your nausea? Well, if you experience any worsening or persistent vomiting, it's time to seek clinical care. We're especially looking out for severe dehydration. If you're barely peeing, feeling crazy thirsty, notice your heart racing, or if you get really dizzy just from standing up, your electrolyte balance might be totally out of whack. A doctor needs to check that out right away.
It's the same deal for pelvic pain warning signs. These are critical indicators that you need to be evaluated right now. Any vaginal bleeding during pregnancy means you need to call your doctor. Period. And if your pain comes with fainting or lightheadedness, that could be a sign of dangerously low blood pressure or even shock, potentially from something like a ruptured ectopic pregnancy.
Let's get to the good stuff in Section 5.
Treatments for your symptoms.
For standard morning sickness, tweaking your diet is absolutely your first line of defense. It's all about playing a bit of defense against your own stomach. Try eating 5 or 6 tiny meals throughout the day so your stomach is never totally empty. Stick to the brat diet: bananas, rice, applesauce, toast. And pro tip, keep a stash of crackers right on your nightstand. Eat 1 or 2 before you even swing your legs out of bed in the morning.
Now, if saltines and toast aren't cutting it, don't worry, your doctor has an entire hierarchy of safe, clinical options for you. You can try ginger lollipops, motion sickness bands, or even switching to a children's chewable vitamin with folate. If you need medication, vitamin B6 is usually the first stop. If that fails, doctors can prescribe anti-nausea meds like doxylamine or ondansetron. And if you're dealing with severe dehydration from hyperemesis, you might just need to go in for some IV fluids to get those electrolytes back on track.
Now, what if pelvic pain is your main issue? Well, for normal structural pain, a few straightforward physical adjustments can work wonders. Keep an eye on your posture, start sleeping with a pillow wedged right between your knees, and wear supportive elastic clothing around your belly and back. If you still need a pain reliever after all that, acetaminophen is generally considered the safest over-the-counter option while you're pregnant.
Finally, Section 6, your MediByte health takeaway. If you remember literally just one thing from this entire explainer, make it this. Your doctor's #1 priority is ruling out emergencies. Nausea and pelvic pain are so incredibly common, and they are usually totally normal. But because they can occasionally be a red flag for something serious, like an ectopic pregnancy or a bad kidney infection, you should never, ever hesitate to tell your healthcare provider exactly what you're feeling. Better safe than sorry, right?
Well, that wraps up our look at early pregnancy symptoms. Before you go, we would absolutely love to hear from you. What was your most surprising early pregnancy symptom, and how in the world are you managing it? Drop your answers down in the comments below. And hey, if you found this explainer helpful, please don't forget to like this, share it with any expecting friends, and subscribe to the MediByte channel for more crystal clear medical explainers. Remember, your body is building an entire human from scratch right now. Give yourself some grace. Wishing you a very safe and healthy pregnancy journey.